The Young Nurses Indaba trade union has accused the health department of not caring about the well-being of the population. The union demands, among other things, the hiring of all professional nurses who have completed community service and the absorption of all COVID-19 healthcare workers. For more of this, we're joined now by Young Nurses Indaba trade union president, Sicina, as well as the Democratic Nursing Organization of South Africa's Gauteng Chairperson, Simphiwe, Gada. Gentlemen, good evening. Good to have you with us tonight on In Focus. Let's start with you, Brarich. You have been in that meeting, March 16th. You've articulated what your demands would have been. Have you received any response at all regarding the demands that you made in your memorandum?
Thank you, Mr. Ndlupe, for having us. Good evening to yourself and your team there, and also the viewers of your show. Thank you very much. Yes, we must, on the 16th of last month, the march was successful. People came in numbers, professional nurses, all those COVID-19 contract workers, healthcare workers, nurses, cleaners, and everyone else, even EPWPs, they came, and on the 30th of last month, we received a response from Gauteng Department of Health. But nonetheless, the response, even though they didn't give us exactly what we wanted, they did respond to us, and they are still crying poverty. Comrade leadership, they are still crying poverty. They are blaming Treasury. They are saying a budget is not allowing them to take all these COVID-19 contract workers to absorb all community service professional nurses. They are still crying poverty. They think otherwise. That is why we released a statement today to say they don't care about this system. Yes, we are defending people's jobs here. We are defending people's jobs, but not only people's jobs, Mr. Mdluli. We are here defending our healthcare system. Go to public healthcare system. It's a mess. We are really tired. We need to hold them accountable, those in positions of authority. Because when they say they can't, like yesterday there were two nurses in one of these Gauteng hospitals. Two nurses nursing 40 neonates in a neonatal ICU. How can you have two professional nurses? When you are asking where are others, they are not sick, they are not absent, they were kicked out by the same system. The system is making us as nurses and healthcare professionals accomplices to murder. They responded, but they are still crying poverty.
Yeah. How do you link that particular situation, for example, to the story that we're currently carrying of what happens there in Rahima Musa? It's a mother and a child hospital where sometimes they actually have no capacity to be able to bring beds on board, and people are actually allowed to sleep literally on the chairs there.
It's one thing that I remember when COVID-19 started, Mr. Mdluli, when COVID-19 started, we were so happy. We were so happy, particularly as young nurses in the trade union, because we were saying at last our ancestors and God has actually responded. There's something that is going to be done about our healthcare system. Not that COVID-19 came to South Africa and it crippled our public healthcare system. It didn't do that. It exposed us. Like, Gauteng Department of Health is just sleeping out there. Not only Rahima Musa. Go to admission wards at Telle Mugwerani. Go to Ward 20 in Bara. It's a mess. No one can sleep there if you are financially well off, obviously. What is happening at Rahima Musa is the tip of the iceberg. Other hospitals are actually tired of complaining. But that issue of people sleeping on the floor, we even have in our own facilities, in our own facilities, in our own wards where we are working. We actually have improvised because that's what we are good at, improvising. And as a result, we have led to the system, those in positions of authority, to neglect us, because we actually create floor beds.
Yeah.
We even give them names.
Yeah.
We say floor beds. Instead of admitting 45 patients, Mr. Mdluli, you admit 57 patients in a 45-bedded ward. Where do you put those patients? Right. What is happening at Raina Musa is also happening at Tendemokorana, at Liratong, across that province. Right. It's happening there. People are just tired of complaining. Instead, they absent themselves, they resign. It's a complete mess.
Yeah. Simphiwe, let's bring you in here. I mean, you, of course, have sat around the table, and this question of crying poverty, budgets, treasury, and so forth and so on, you had preempted, in fact, to say, you know that this is going to be the story that you're given, but as Denosa, you're willing to actually take this up with Treasury yourself, but you need the department to come on board and give you the necessary support. Are you getting the necessary support?
Well, thanks, Thabo, and greetings to the viewers. Well, Thabo, we can confirm after we last spoke that there is progress that we are trying to, to register. All the instruction has already been issued around EPWPs. Their contract has been renewed, has been extended. They will be continuing. On the issue of the post-ComServe nurses, I personally had a one-on-one with the Premier, because I indicated that this is an issue that, it's not for the Department of Health alone as a component, but it is an issue of the Gauteng provincial government. And I can tell you that on the 31st, we're able to then get the contract of the post-ComServe nurses to be, they extended it for 2 months, pending the engagements that we're having with the Premier, because I indicated that we have found posts in the system. We have found posts in the system. And one thing I can tell you, which I'm still putting my head on the block, is that all those nurses will be employed. And then on the issue of the COVID-19 contracts, that is also something that we're attending to, because out of the 2.4 billion that was initially given, allocated, now that they've allocated the 1.2 billion, we said they must proceed and employ those ones. And now we're trying to get the half of that money. And it is something that when we characterized it, we said that let all the organized labor unite to ensure that we save these jobs, because it is evident, as my colleague Rich there is indicating, that what we are seeing since the 1st of April now on the COVID post is that we are seeing that the quality of healthcare is being compromised, because these people were playing a crucial role. So there's evidence, there's glaring evidence that they are needed in the system. And we can assure you that having engaged other organized labor and having engaged other stakeholders within the health sector, we're all agreeing that this is not a fight of the Gauteng Department of Health. It's a fight that the Minister of Health and the MEC of Health in the province have got to avail funds. And the Premier has committed that is going to work with us in terms of resolving this issue. So we have actually now taken it to the doorstep of the Premier as the head of government.
All right, let's take a break. We'll come back in a moment to get more responses then from Sicina as well as Simphiwe, Gada, representing nurses tonight, and the challenges in the healthcare systems in the province of Gauteng. Welcome back live with us tonight here on In Focus. Young Nurses Indaba Trade Union President Sicina, as well as Denosa's Chairperson, that is Simphiwe Gada here in Gauteng. Rich, let's talk then about what you're hearing coming out here. These, for me, are the precise kind of answers that you have been looking for. For example, the issue of the post-community service nurses having been addressed. Okay, it's temporary. It's a 2 months extension on the contract. Is one of the issues that you certainly have been talking about. The EPWP workers have their contracts now renewed. Okay, it's not been made permanent, but at least it's a move in that direction. There is talk around even the COVID-19 nurses and some money being allocated there. Do you see this as an improvement?
Indeed, we see it as an improvement. We can't really lie. We know the system is finding itself where it is, where obviously it's engulfed with corrupt leaders who actually are selfish and always focusing on their own pockets. But our move for us marching to the Gauteng Department of Health was very critical, and we are patting ourselves at the back to say it was very necessary for us to do that. I was even saying to when we were going there to say let's fight it in the street, let's make noise, while the likes of Comrade Gada were doing that talk in the boardrooms. It really worked to our satisfaction in a way, even though we are not hoping that those 2 months, we are not going to say at the end of that 2 months extension of community service professional nurses, we'll go back again to the boardroom to say, but you promised to create posts and absorb all of them. And we are even saying it doesn't mean that if a person was, if a professional nurse was doing his or her community service at Liratong, for example, or at Bara or Telemukhweran or Tembisa, they need to be absorbed there where there is a space, because there is a space everywhere. It's an issue of having posts that are funded. We are happy with that. So we are still happy with the fact that, remember, a lot of EPWPs were being shown that door. That is what the department was saying. For now, that they responded positively to say, okay, let's renew the contract, but where we are sitting now, we can't absorb them into the system. And also the insourcing of security personnel, the private security personnel, they are saying they are working on that. We are saying don't work on it. You started working on it in 2012. We are still working on that even today. Absorb them, because they are always complaining when they are always complaining. They are always forced to withdraw their services. And when we go to them, why are you withdrawing your services? Now, why don't we see you in your stations? We were not paid. It's so not fair. It happens almost every month that they are not paid. And the middlemen will complain and blame the system to say, I was not paid by Gauteng Department of Health. That is why they are actually not paid. Right. So we are happy with the response so far.
Yeah. But I mean, I guess in such you need to also, as the young nurses in Indaba Trade Union, get to improve the quality of your engagement with the department so that it's a little bit more meaningful, right? So if you issue a statement and say, no, we completely discard your response, yet there's been movement, it means there's a disconnect here in how you're engaging with them, because these are things that you're supposed to have knowledge of, that there is, for example, a renewing of the contracts or extension of the contracts for 2 months, or a renewing of the contracts for EPWPs, so that you don't make a statement that says, no, we completely reject everything, when there are things that you're actually seeing as an improvement.
That is why, even on our statement, we said we were looking forward to have them sitting down around the table with us as a union, but they didn't do that. They actually didn't do that. They responded in black and white. And when they respond in black and white, they respond in that vague manner where we are saying, but you are not telling us anything. We are just crying poverty, saying we are looking to do that. We caught that particular comrade there on our sister union outside. That department, that's why we were saying that department, we were expecting that department to say, okay, well, I need to. Young nurses in the Trade Union leadership, come, let's talk about, put me to a memorandum of demands, because obviously in the memorandum of demands, you can't write the entire paragraph in those memorandum of demands. Only obviously because they usually sometimes want to remind us as young nurses in the Trade Union to say, you are not in the bargaining council, regardless of whether you are making the noise you are making outside, but they will just use that to run away from engaging us, even though we are actually challenging and making noise about like critical issues that are affecting those who are employed and those who are actually the beneficiaries of this public health case.
Comrade Chairperson, what are you doing to bring these comrades into this bargaining council so that their voices are also being heard in these talks?
What are we doing?
Yes.
Tabo, there's what we call the threshold for you to get admitted to the bargaining council. What they should be doing is to recruit, because you get in there with the numbers. That's how the labor system in the country is designed. But because we live in a constitutional democracy, they can speak, they can do all manner of things that they are doing. But in terms of the organizational rights, having the rights to sit on the table with the employer, engage, contribute in the bargaining council, they don't have. They don't have those rights. So it's a matter of recruiting. If you recruit and you've got enough numbers, then you are able to then apply to be admitted into the bargaining council. Once you have been admitted, then you can be able to then have the right to summon or have the right to request a meeting with the management of the health or whoever that is in government or in a space that you organize in.
But I guess what I'm saying is I understand that, and I understand the technicalities of that, but it's a minority voice that is important. They might not be your members, but they are members of the sector, and what they've got to say surely is also important to you so that their views are taken on board as you sit around these tables.
Tabo, you see, even how we refer to each other as comrade with comrade Rich, because we do take what they say, because their voice is also critical. These are our colleagues. So on certain issues, of course, we'll form tactical alliances where we are challenging, because for us, the enemy is the same. It's just a matter of how we deal with issues, because we raise quite the same issues. So from time to time, we do form tactical alliances, even with those that are not in the bargaining council, to raise worker issues. Like on this one, we are all united. We are all saying the same thing, that the COVID-19 posts have got to be renewed, all of them. We are saying the same thing, that we don't want any retrenchments happening in the Department of Health. And moreover, that is government that is retrenching. That is setting a bad precedence even in the private sector. We'll begin now to notice that workers who are in the private sector get exploited precisely because of this bad attitude by government, who is supposed to be the custodian of the labor statutes in this country. But we see government being the one that is offending, that is disregarding these issues. So our fight, Thabo, the fight of workers and the plight of workers is what should unite all workers, and is what must unite us, and we will unite, Thabo, because besides these things, there are certain engagements that happen between ourselves as leaders who say, if we are having a fragmentation of unions, we are going to weaken the voice of labor.
Certainly.
So it's something that we are attending to.
Let's talk to one item that is still a standing item and has been a standing item for a while, and that is the item of safety and security. There's the issue of the insourcing of private security personnel, and of course this has been going back and forth, and you hear the department also saying they just can't afford to have security guards at every hospital, or so to speak. I don't understand what the difficulty is there, but how far are you in as far as those conversations are concerned?
Well, the decision has already been taken by EXCO. It was approved. The challenge that we are having, which is a big threat to our democracy in this country, is the issue of corruption. Because I can tell you, right now as we speak, all the companies that are operating in our health facilities, they are on a month-to-month contract, because we said we don't want these companies to be on a long-term contract, because it's going to stifle progress that we should be making in terms of appointing security guards directly into the system, insourcing them. So in some instances, it has already begun. In the West End, there was a pilot to say how do we, appoint these security guards? How do we structure their benefits? How do we train them, the recruitment process? So there is some improvement that is happening there. However, we have challenges of corrupt officials within the system whom, when we take decisions, then they don't implement. Some of these officials are direct beneficiaries of these month-to-month contracts because, Thabo, the reality of the situation here is that these security companies are the owners who are registered in the papers are not the real owners. It's politicians who are fronting. It's politicians who are benefiting in these security companies. I mean, you can go and look at many members of the ruling party who have got a background in MK and so forth. The same thing is happening at PRASA because the fight is about the resources. So we've got people who are in the ruling party who have taken a resolution to insource, but they then frustrate the process by working with corrupt officials within within the bureaucratic system of the department.
Simphiwe Gada, Chairperson of DENOSA in Gauteng, and Sicina, he's with the Young Nurses Indaba Trade Union. I appreciate your time and thank you very much for joining us tonight here on In Focus.